House of Representatives Committee on Public Assets have cleared the management of the Nigeria Electricity Liability Management Company, Nelmco, of allegations of financial impropriety levied against it by the Association of Public Policy Analysis, which was signed by its president. The chairman of the committee, Honorable Ismail Dabo, made this declaration on Thursday at a public hearing where both the petitioner and the management of Nelmco appeared before the relevant committee of the House. Honorable Dabo said the committee, which immediately went into detailed investigation into all the allegations leveled against the Nelmco and found them not guilty in all fronts, including the allegation of extension of existence, which allegedly was supposed to expire in 2017, as well as the disposal of all assets recovered and disposed by the Nelmco management. The managing director and chief executive of Nelmco, Mojoyin Oluwa Dekalo Thomas, also said the company has never been in breach of the status that established the company and that due process was followed in all its operations.
Since she cannot approve to purchase office by herself. So, and they have given us the documents, all the approvals. So that's in brief explanation on that. So I think on the rent part and the permanent office for them, that is the outcome of our investigation on that. The only thing we can do as Parliament is to request for whether she have followed due process or not. And what is the due process? She cannot approve anything for herself. She have supervising ministry, the FEC is there, and she have given us the documents that gave her the go-ahead for them to purchase a permanent office. And that is what we're able to establish on this.
And then went to the Honourable Minister, who's the chairman of our board, went to the Federal Executive Council and got the approval of Mr. President for us to purchase the property. So we have our FEC approval, we have BPP approval, we have board approval, and the property has been purchased, sir. So we do now have a permanent office. Thank you, sir.
This conference is occurring at a very opportune time. Non-communicable diseases has become an epidemic in Africa, and it is time Africans confront it or be consumed by it. So we bring this conference to Africa, to Nigeria, especially Nigeria because Nigeria has the highest number of cases given its population. It is time to deal with the problem of sickle cell diseases. It is time to deal with the problem of diabetes type 1 in Africa. It is time to deal with rheumatic heart diseases and other heart diseases. It is time to deal with these through early detection and providing services to as close as possible to where people live and work. Early detection is the answer. And of course, changes in lifestyle is needed. Move appropriately, eat appropriately, exercise, and ensure that you monitor your blood pressure, you go for your medical checkups to ensure if you're sick is detected early. Pain Plus is to bring this service to the first referral facility, not just at the community level, even specialized service at the primary level, so that anybody who is sick of non-communicable diseases is taken care of. We don't have to wait until you have access to tertiary hospitals, teaching hospitals, specialist hospitals. You can get appropriate and quality care for non-communicable diseases at the first referral level, the primary health level. That is the only way to save life.
So, the things that are really necessary, you need people, and you need to train people. And so we believe that nurses, clinical officers have enormous potential to be able to do things that normally have been done by specialists in many countries. And so providing them with training to do things like cardiac ultrasound, managing insulin, managing hydroxyurea. So the people are really essential. There are some pieces of equipment that are important that health facilities don't typically have. So ultrasound equipment, diagnostics for sickle.
The decision was unanimously adopted by all the members of the committee.